Hi, I'm Dr. Sarah Mercer-Bowyer, an ambulatory veterinarian at Sierra Equine, part of Loomis Basin Equine Medical Group. I'm going to be going over how to give some common medications that your veterinarian might prescribe for you to give at home. We're going to go over how to give oral medications, as well as an IM injection, and lastly, how to give Domo gel under the tongue. One of the most common medications that your veterinarian might ask you to give orally is Banamine Paste. Here, I have my syringe dialed to the appropriate dose for this size horse, and I'm going to give this by mouth. What I find is helpful is to use your dominant hand, the hand that you write with, to hold the tube of medication. I use my non-dominant hand to sort of brace myself and hold on to the horse. We're going to put this medication in the corner of his mouth. I usually pause here to give him a second to spit out whatever lovely things he might have in his mouth, and then you're going to slowly depress that plunger. If you give it nice and slowly and you give them a chance to spit out any hay or food they might have hidden in the back of their mouth, it's really hard for them to spit out that medication. It will usually sort of stick to the tongue and the roof of their mouth, and they'll get what they need. Next, we're going to talk about how to give an intramuscular injection, commonly abbreviated an IM injection. Common things that you might see us give as IM injections would be vaccines, certain antibiotics, occasionally things like acepromazine, or certainly the most common one that we prescribe for owners to give IM in the field would be Adequan. Oftentimes what we'll do with that is show you how to give the first dose and then leave you with the materials to give the subsequent loading dose. It's usually an injection every 4 days for a series of 7 doses. So in this case, Coffee here, our very cooperative patient, is good about injections, and we know that. So I have him cross-tied, so I have both hands free. If you have a horse that's a little bit more sensitive, or you've never given an IM injection to that horse, definitely have them untied and have someone helping you so that if your horse gets scared, they can boogie and get out of the way without scaring themselves any further. The first thing you need to know is which muscle we're going for, and we're going to go over those landmarks with you now. The most common place we'll ask you to give an IM injection is in your horse's neck. And to find that spot that you want to give the injection, there are 3 important landmarks that you need to know. The shoulder is the easiest one to find here. That's going to be what we call our caudal border, or your rear border. Along your lower border is the cervical vertebrae, and if you feel on your horse, believe it or not, you can feel their bones, so their spine runs down here low. The last thing is the nuchal ligament, and that runs from the top of the head between the ears all the way down onto the withers. If we use those 3 landmarks, we have a very clear triangle here that you're going to aim for. Another easy trick that I use if you're nervous, especially for the first time, is if you can find the shoulder on your horse and you put your hand just in front of it, if you go about the middle of your hand, you're always going to be in a safe spot. So now that you have the area that you're targeting to give your IM injection, we're going to prepare the site. The most important thing is to start with a semi-clean, dry horse. Your horse doesn't have to be show ring ready and sparkling clean, but the last thing we want to do is introduce the needle through wet skin. So wet, muddy skin is not our friend. If your horse is a little dirty, as many horses are that live out in the pasture, navigate around those spots, and we're going to use some rubbing alcohol here to prepare an area. I like to wear gloves when giving injections. It's just an extra way to make sure we're not introducing anything unnecessary below the skin. We're going to take our alcohol swab in our area that we chose earlier, and we're just going to give it a nice wipe. When I look at the edge of this alcohol, you can see Coffee is actually surprisingly clean today. Once you have your spot prepared, you're going to use your dominant hand to hold on to your syringe. You're going to take, in my case, my left hand, and unsheathe the needle. Next, Just to the side of the area that I have prepped, I'm going to take a little pinch of skin. Not only does this give your horse a heads up that something's about to happen, but you can use that to brace your hand so that if your horse moves a little bit, you're ready to move with them. We're going to take our needle directly perpendicular to the skin and insert it straight in all the way to the hub. It's really important that you insert the needle all the way so that you are stabilized and we have it exactly where we want it in the muscle. Before going ahead and pushing down the plunger, I'm going to reach back here and pull the plunger back. That's called negative pressure. You'll see your veterinarian do that to make sure that we're not getting any blood back and that we're in a safe spot to give the injection. You'll notice I have my hand braced against his neck so that if he were to walk or move or toss his head, we're still going to be able to stay stable and against his neck. Next, we're going to go ahead and push that plunger down nice and slow. The key to giving an IM injection is being sure with your movements and going nice and slow so that nothing you do startles the horse. Once that plunger is at the bottom of the syringe, we're going to go ahead and pull straight out. And as you can see, the site looks the same as it did when we started. For those of you who have horses that might need a little bit of sedation, say for farrier work, or they're apprehensive about needles and need a little cocktail before we come out to work on them, a common product that we'll have you administer at home is Domo Sedan Gel. This is a sedation product that has to be given transmucosally. The most common way we give that is by giving it under the tongue. If you just squirt this medication into the corner of your horse's mouth, it's not going to be absorbed. And if your horse is to eat this medication, say in a little bit of grain, it also won't work. So the key to this medication working and getting your horse nice and sleepy and cooperative is that it has to go under the tongue. Here, wearing gloves is not an option. When you're giving oral medications, the most common reason you would wear gloves would be to keep your hands clean. In this case, when giving Domo Gel, you absolutely have to wear gloves for your own safety. If this product were to touch your skin, because it's designed to be absorbed easily, it could make you sick. So you absolutely need to wear gloves when giving this product. Same as before with oral medications, I'm holding this syringe in my dominant hand. I have Coffee unhooked from the cross tie since I know he's going to toss his head and be a little bit grumpy about this. I'm bracing my hand against his head, knowing that he's going to toss his head, and then I'm going to slip this underneath his tongue, just like that, and go ahead and squirt the plunger down. It's a smaller volume of medication that you're giving, and it's a gel, so it's going to stick to the bottom of their tongue. It literally just needs to come in contact with their oral mucosa. Hopefully this series has given you some more confidence and some new skills to work on while you're at home with your horse. The appropriate medication in the right volume and given the right way is really important. If you have any hesitation at all about how to give a medication, if it's the right dose or even the right medication, please reach out to us by calling or emailing and we'll be sure to get back to you right away.